Good morning, everyone. We get a lot of questions. What is the clinical client in-person shadowing experience, whether for new clients or existing clients? Like, what does it entail? I'm interested, but can you tell me a little bit more about it? So I figured instead of giving you a long paragraph of what it is, let me just show you a client that is visiting us today. I'm going to show you from start to finish what the experience is, what we're going to do, and I'm going to show you different aspects of it and what to expect when you come here in person. So let's get to it.
Walking into the office before a morning huddle at 7:45. Shadowing experience or not, we always start off with a morning huddle reviewing 1 week out and then their current day. The whole team is engaged and every team member owns their columns. Every office does this a little bit differently, but you'll get to see our take on it. And here's the surgery room, double arch all in X today, and here's my assistant Stacy. And here's the fancy plan on the whiteboard. If you're curious, the reduction was around 4 to 5 millimeters on the maxilla. I printed the maxilla for Dr. Cliff so he could better visualize the plan and most importantly, the pterygoids. And here's Stacy taking the pre-surgery scans with the fiduciary markers placed. Amber's hard at work on the phones. Dr. Cliff's wife, Julie, got to see some of the phone calls in action as well. And here's Dr. Cliff talking with Dr. Chad on what I assume is new patient flow and language strategy. A little bit of a deep look there. Now Dr. Cliff is taking the photogrammetry scan for the upper arch, getting a feel for it. Beautiful. Stacy is scanning the upper arch to submit to the lab. Getting to see the entire digital workflow in another perspective is great during the shadowing experience. Erin, one of our assistants, running the consultation before I go in. A little banana break after the upper arch. Allie getting ready for her next new patient. And here's the design we got back from the lab. Nice and flat, great access hole positions. Not great spread on the lower, but the mental was pretty anterior and there was no bone on the posterior to work with. But overall, ended up being a great result. The patient was super happy. Take a look at that smile. And here's the post-op CVCT, 6 on the upper, 4 on the lower, and a photo with Dr. Cliff and his wife. We couldn't get the entire team as Dr. Cliff had to leave a little bit earlier, but I'm glad they had a fantastic in-office shadowing experience. Let's get into the testimonial.
Hi, my name is Dr. Clifford Young. I help manage 2 offices in Southern California, one in Arcadia and one in Upland. One's called Premier Dental Aesthetics and one is called Young Dental Health Center. And Dr. Chris invited me over to shadow the practice with Dr. Chad. And a couple things that are most valuable that I learned today is that it's a team effort. I've taken a lot of CE, but I also noticed that when I take CE, it's very difficult to implement a lot of the systems in the practice. And to be able to perform the dentistry that I want, the team has to be on board. So seeing how the system operates, seeing how the back team is able to build the relationships with the patients and how that's transferred over to the doctors and helps with case acceptance has been valuable. The second thing that was really beneficial for me to do was shadowing Dr. Chris and him doing a double arch. He's very efficient and very quick and also very clinically sound. So seeing how he is able to place implants, we were able to even place 2 pterygoids today. So that was really awesome to see. Yeah, it's been a very valuable experience. What's the first thing that I'll implement in the practice is utilizing my team a lot more during the patient experience. In our practice, we call it the perfect patient experience. And oftentimes it feels that me, the doctor, is doing the whole experience. So being able to translate that to my team, so it's a team approach, is probably the first thing I'm going to implement. And there's a lot of pearls that I gained clinically that Dr. Bono taught me. So I'm definitely able to implement that when I go back home. So I worked with Dr. Chad and Dr. Bono it was an investment that I knew would pay off. Oftentimes we look at the investment and we see how much it's going to cost, but if we're able to change one thing in our practice, that changes the trajectory of how we're going to practice the rest of our careers. The ROI is definitely there. We've seen our practice grow in terms of case acceptance. If it increased, I measured it when we at the beginning of the consulting and 3 months after, and I think we got about a 10 to 15% growth in case acceptance. That was cool to see. Clinically, seeing a surgery and seeing how the flow goes and the efficiency of it makes me a lot more confident to be able to do that in our practice. So I'm starting my full arch journey, and just seeing how Dr. Bono has scaled his practice is very beneficial to see.
All right, so there you have it, the in-office shadowing experience of Clinical Climb. We tend to focus a lot on the new patient experience in these shadowing experiences. So you can see everything from the patient experience from start to finish, including the handoffs, including the doctor communication, the team communication, so the assistants, the treatment coordinators, from the beginning to the end, to how they present treatment, to how they talk about the financials. And we also bake in a few consultations in there for full mouth rehabs or all on X or whatever the consultation may be. On top of that, you also get to see the clinical side. So for this day, for example, it depends on every doctor, but this specific doctor was interested in All-in-X. So we did an All-in-X case. I went over a lot of tips and tricks. I did pterygoids because he was interested in pterygoids and the techniques. I showed him how that works, and then the whole process for All-in-X from start to finish, the digital workflow. So it's all tailored to the doctor, but there's always a foundational base, new patient experiences, consultations, phone calls, how we present treatment, how we present finances, and then the clinical experience can be a little bit tailored to, or ideally what you would like to see for what you're interested in. If you have any questions about the in-person shadowing experience, or if you're interested in coming into our office, we only do these about once a month, sometimes twice a month. We make an exception. If you're interested, just send me a DM on Instagram at Dr. Chris Bano. Until then, I'll see you in the next one.